this is the occipital bone, and today we'll be talking about the anatomy of the occipital bone, its important landmarks, and also the anatomical points of the occipital bone, inshallah. So let's start. So occipital bone, it has three parts. So this is the squamous part, this portion is the squamous part, this portion is condylar part, and this is basilar part. Squamous part, condylar part, and also this portion is the basilar part, and this is the foramen magnum. So let's talk about the squamous part. It has two surfaces, external surface, and this is the internal surface, and two superlateral or lamboid border, and two inferior-lateral or mastoid border, and three angles, one superior angle and two lateral angle. So let's talk about the external surface. This is the external occipital protuberance, and the most prominent point of the external occipital protuberance is called inion. This portion is called inion. This is the highest nuchal line, this is the superior nuchal line, and this is the inferior nuchal line. And the line extending from the external occipital protuberance to the foramen magnum, this is called the external occipital crest. And let's talk about the internal surface. This is the internal occipital protuberance. This is the sagittal sulcus, this is the transverse sulcus, and this is the internal occipital crest. And the triangular depression close to the posterior margin of the foramen magnum, this is called the Vermian fossa. And let's talk about the condylar part. So in case of the condylar part, it consists of two parts. This is the jugular process, and also the rest of the part is called condylar part proper. So this is jugular process, and the rest of the part is condylar part proper. And in case of jugular process, there is two surfaces. This is the upper surface, this is the lower surface, and anterior border and lateral border. And in case of the condylar part proper, there is the occipital condyle, there is the posterior condylar canal, and this is hypoglossal canal. And this is the jugular notch, and this is the jugular tubercle. So this jugular notch, it forms the jugular foramen, and this is the hypoglossal canal. So this is the hypoglossal canal, and this is the posterior condylar canal. Now let's talk about the basilar part. It has three surfaces. This is the anterior surface, this is the superior surface, this is the inferior surface, and it has two borders, two lateral borders. And the superior surface, it forms a shallow gutter that is called clevus, and the anterior surface is called basiocciput with articulations with the basis sphenoid and forms a primary cartilaginous joint. So now the anatomical points, so we'll place it like this, and this is the occipital bone. Squamous part is directed upwards and backwards, basilar part is directed upwards and forwards, and foramen magnum is directed horizontally downwards. So this is all about the anatomy of the occipital bone. Thank you.